Hello everyone, welcome to Eben Health. This is Davis, and today we want to discuss what is a stroke. But before we begin, hit that subscribe button and that like button, they help me go a long way. Now, I want to first describe the types of stroke. There are two, and when you understand them, you almost understand the causes. Ischemic stroke is whereby the blood flow to the brain is occluded. This stops the oxygen from going to the brain and to the nutrients. And it's the most common cause of stroke. It's usually caused by things like blood clots. Then there's what they call hemorrhagic stroke. A hemorrhagic stroke happens when there's a leakage and this causes blood to flow into the brain. When this happens, it increases the pressure on the brain tissues, thus damaging them. So this is the second type of stroke, which is caused by things like trauma and aneurysms and things like that. Now, stroke is very simple to identify. Usually, a person has what you would call focal deficits. Sometimes you see you lose strength in one arm or in the whole leg. If it's on, you can find someone maybe they have lost strength, they can no longer move their arm. That's what someone will call paralysis. Some people have like one face falling, or one side of the face falling, but it does not affect the eyes. Uh, then also you have things like convulsions, you have things like severe headache, especially if there is hemorrhage. So those are the signs of the stroke. The most common cause of stroke is hypertension. Hypertension is defined as having your blood pressure above 140/90 millimeters of mercury. Have you seen people where they put the blood pressure cuff and measure those numbers the doctor writes? That is the blood pressure. Now, if any of those numbers is above any of what I've said, even if one of them is low, we consider that hypertension. You can call that systolic if it's above 140 or diastolic if it's above 90. So some people you find that the upper number is okay, but the lower one is high, but still the doctor says that you have diastolic hypertension, which has its own causes also. So the doctor will still say that you have hypertension. So when you have hypertension, this leads to damage of the blood vessels, and therefore there's a higher chance of them do bursting or getting blood clots. The main cause of a stroke is usually trauma. That is when someone hits you in the head, you fall off a border, you're playing football and you hit yourselves. At times, something can happen to the blood vessels, which predisposes them either to form a blood clot or to bleed into the brain. So that's another cause of trauma. The third cause are bleeding disorders like aneurysms and AVMs. An AVM is an arteriovenous malformation. Now, an aneurysm is when you find so basically it's like this. So when blood is flowing through your system and it's going to the muscle, it usually first moves through what they call arterioles. Yes, then it goes into what they call capillaries. Then from there, it goes into the muscles. Then from the muscles back to the capillaries, and then into the vein, the small veins. The fourth cause is taking illicit drugs. It has been seen that drugs like marijuana actually cause stroke. This is because drugs cause what they call a hemodynamic effect, which leads blood vessels to constrict. Smoking can lead to things like plaque formation in the in your blood vessels. Then it also stimulates the release of epinephrine, which makes the blood vessels constrict. The other things like age, the older you grow, the weaker your blood vessels. The more they're prone to damage, the more they have undergone wear and tear. So they're more prone to what? To either bursting or to formation of a blood clot. Yes. And the last common cause is diabetes. This leads to the deposit of fats on the inner lining of the blood vessels. So it can lead to things like clotting because the fat also disrupts the blood flow. So when someone has diabetic, and then also you find that people who are diabetic usually have hypertension because of the effect with the diabetes on the blood vessels. Therefore, they are more prone to breaking to tearing, and to blood clot formation. Yeah. This leads to the deposits of fats on the inner lining of the blood vessels. So it can lead to things like clotting because the fat also disrupts the blood flow. So when someone has diabetic, and then also you find that people who are diabetic usually have hypertension because of the effect of the diabetes on the blood vessels. Therefore, they are more prone to breaking, to tearing, and to blood clot formation. Thank you. We've reached the end. Now, there's a lot more to talk about stroke. And if you want to discuss more, you can reach out to me in my DM and we discuss more. But yeah, this is the gist of the matter. Now for stroke, basically to prevent it, there's only one thing. Weight loss is the most important thing. When you lose weight, the chances of getting stroke also go down. You stop smoking, eat healthy, eating healthy, that is leaving out sugar and processed carbs. Then also make sure you know your blood pressure. If you're above 40 years old, make sure you know your blood pressure and make sure you know your body mass index. If your blood pressure is high, regulate it and make sure it comes back down.